Hi, I'm Leah Wilson, Executive Director of Stand for Health Freedom, a nonprofit dedicated to protecting basic human rights. Thank you for tuning in to part 2 of our exclusive interview with Vera Sharav, a Holocaust survivor and renowned champion for human rights. Vera is an expert on biomedical research ethics, and she has rare and valuable insight into the landscape of public health today and the government's response to the coronavirus. In this second segment, Vera draws parallels to what she's seeing happen today and what her family saw in Nazi Germany. She also talks about the dangers of using children and minorities as research subjects and the dangers of blindly following authority, and what we can do to stand up to protect ourselves, our children, and the most vulnerable among us. I hope you enjoy the second part of my conversation with Vera.
This is a eugenics way of looking at the world. Eugenics was exported from the United States to Nazi Germany. It never was abandoned. It just got its name changed. So population control, there's a population council. There are all kinds of institutions that essentially continue to push the eugenics agenda with policies that they easily set because of the money. So some populations are targeted for weeding out. That's the eugenics kind of way of reducing populations. You weed out those who you consider lesser, inferior. The African-American community and also people of color in the United States have in fact been very much targeted for medical experiments that were anything but medicine, that were really criminal. Everyone knows about Tuskegee and the syphilis trials on African-American men. Black and Hispanic children have been used as guinea pigs repeatedly in experiments that should never, ever have been done. The experiments, the drugs, and the vaccines that they were testing were horrific. Is it too explosive or whatever to compare Nazism? I'm sorry, this is what Nazism was about. This is how they did things when they began with the children. The Jews in the Nazi order were the despised minority. And here we have the blacks and Hispanics being treated like a despised minority, like their lives don't count.
So, how do we stand up for these issues in terms of, in this day and age, we're seeing, or in this specific time, we're seeing specific minorities being targeted?
We have to stop it, and this might be the trigger. If the African-American community gets up and says no, and really says no, and we help them to say no, that's very important.